So, as we come back together, we are going to a group to report on what their health disparity is and what are the solutions. Before that, I just want to make a quick announcement because there have been several questions about the webcast and about getting the slides. The webcast is being broadcast live. It takes about 2 weeks to be archived, and then it will be up. And so you can access it and follow along with me. After this symposium, there will be an email to all of the presenters getting approval to be able to use their slides, and we plan to post those slides too. Now, how would you get access to that? I plan to use the registration list and send out an email to all those who have registered about getting the webcast and actually getting the slides, okay? But give us a little time so that we can get everything in place. Okay, that being said, I wanted to go to this group right here. We did 1, we did 2, 3, and now we're moving to 4. And just so you know, this group over here, I plan to come to you for the next breakout session. Okay. So why don't we go to you and let us know what your disparity was.
Okay, we are group 4, and we just knew you were going to pick on us.
You knew it. You knew it. You knew it.
And our disparity was heart disease. And probably the first thing that we came up with was changing protocols for treatment of non-white, non-males, because the profiles for onset of heart disease are different if you're not a white male. Okay, and we don't think that's happened. But then we got bigger, because we said this is not just about heart disease.
Okay, so let me hold off on one second, because I do want to highlight this. We haven't talked about this as much about race and race as biology, but I think it's a good time to begin to talk about it briefly, in the sense of, yes, perhaps it is different, but what is that difference? And in medicine, we don't even talk about it, right? We take the science as if the science is something that should be just used and not questioned. And so, as you said, right, the tests are for those who are in the group, right? Who designate
that the research
themselves.
Has been on that we know about.
Right, who designate themselves as a particular group. But we are all human, right? And so what does that mean? When we say a person checks the box as white, as I tell my students, right? I can check the box as black today, but I know that I'm multiracial, so do I check that tomorrow? And the next day, do I check something else? And so when we talk about the protocols are off, I just want to be clear that we should not go to the research that just says that there are racial disparities. Because what that is that I think I'm something, so I'm checking the box. And that perhaps the protocols need to focus on, there's a lot of information out here, how can I help you? So I just wanted to identify that, and then
that's great. Yeah.
Go to your solution, the other solution.
Well, as we look larger than just heart disease, but to racial bias, we felt that medical education and interventions with attendings, with current attendings, was really important to do the stereotype negation training, and to not only to educate to do that, but also to build in disincentives to the implicit biases. This is the interpersonal, so that we need to be punishing people for practicing what they're thinking, or may not be aware of what they're thinking. And we felt not only is it that's necessary in medical education, but also with the supervising the attendings who are actually doing the training of medical professionals. But it really, that education needs to start early childhood. And so looking broader structurally, if you will, we're talking about, if we're, looking into early childhood education, universal early childhood education, then that should be part of this racial consciousness that was being talked about, should be part of that. We also felt that it was necessary to collect and analyze data by race locally, and then have a group of healthcare providers actually analyze and then make changes based on those data.
Okay, so anything else?
Number one, we're not sharing that data. Number one, we're not even sure that we have the data by race. We have it by other things, by proxies, but not necessarily that. And I think locally we need to make sure that, although there are competitions within our healthcare provider system, that we need to be figuring out the way to work together in order to bring race to a level of consciousness.
Okay, thank you. I'm going to take just a minute to discuss a couple of things in regards to that, and then we are going to go collect lunch and come back and hear our keynote speaker, Cheryl Boyce. And then after her about 20-minute talk, then we're still doing the book signing. Are we still doing the book signing? And then we're going to, Professor Randall published a book a few years ago, Dying While Black. And so we're going to do a book signing and then move on to the last panel. And so what I want to say, that as we continue this discussion about health disparities and how to address it, that there are 2 points that I want to raise. One is that we talk about it in a way, and I am guilty of this as well, is educating doctors, right, to do better. And I want to say that's true, right? We need to educate ourselves to do better, but to empower everybody in this discussion, whether that be the patients to understand the burdens that are placed on their health because of the discrimination that they face, that empower physicians to be able to discuss, right, their feelings of powerlessness in terms of treating patients as patients when you only have 15 minutes to see people because health insurance is paying you to have particular outcomes. And so as we begin and continue to talk about this, right, we can't forget the lack of power that lots of people have in this system. And so as we change it, we need to think about how are we going to shift the power. And in following that, we need to think about how are we going to shift the power, particularly from my perspective, away from using race as biology and understanding race as social context. Because even if we collect the disparities, what happens is then we have a scientific link that we make, even though it is not supported by the science, right? And so we make this link that perhaps blacks suffer more from heart disease, so there must be a genetic, cultural reason, okay? And that doesn't help. As I told my students, right, when you walk up to me and say, as a black person, you are more likely to suffer from heart disease, that does me no good because I can't change being black. So there's no solution that you're going to come up with, okay, that's going to change that. If you say that I suffer more stress because I am black, then we can change the situations in which I am stressed. We can change the environment. As Professor Randall said, if I need to eat better, then you need to put a grocery store in my community, right? That's the thing you can change. You cannot change my race. I can check a different box, okay? And that's how we come up with the disparities, not by looking genetically at people and saying you're black or white, because we can't ever do that.
What we were thinking of was collecting data,
Yes.
showing the racial
Yes.
impact, and not
Fabulous.
not the fact that it's, you know, set in stone that this is going to be
Yes.
on the assumption that there should not be that impact, that difference in outcome,
Right.
that difference in treatments, all of that.
Right, and not responding just to your group, but to understanding you don't want to fall into that, right? That as we say the disparities, we're not linking it up, and I think that's what happens oftentimes. I think Dr. Van Ryan was talking about at the end of medical school, right? That African American physicians have a different view than when they began. Okay, and in part that's because we link the data up to this belief that there's some scientific reason, right? You can't change the science of someone. Let's hope you can't, okay, that we're not moving down that road, okay, that we need to focus on the other factors. With that, please go and collect your lunch and come back and we will hear our keynote speaker. Thank you.